In the first video of the series about the anatomy of the upper limb, we will be dealing with the bones of the upper limb. Before anything else, we should review the divisions of the upper limb. Essentially, we can divide the upper limb into two parts, the pectoral girdle and the free upper limb. The pectoral girdle of the upper limb is called the cingulum membri superioris or cingulum membri pectorale. These two terms are equivalent to each other. The free upper limb is called the pars libera membri superioris. These regions are made up of different bones, both the free upper limb and the pectoral girdle of the upper limb. Different bones form them. The pectoral girdle of the upper limb consists of two bones, the clavicle, that is the collarbone, and the scapula, that is the shoulder blade. The free upper limb is made up of more bones, many more than the girdle, which is why, to make classification easier, we can further divide the free upper limb into three parts. The most proximal part, that is, the one closest to the trunk, is the brachium, or arm, the antebrachium, or forearm, and the manus, that is the hand. And it is important to emphasize here that the hand is not synonymous with the upper limb, even though in everyday language and for lay people, this is much more common. Here, you should keep in mind that when we put on a glove, we actually pull it onto our hand, and that shows where the hand ends. This makes it easier to remember and not to confuse things during anatomy colloquiums or exams. So, when looking at the bones of the free upper limb, we can say that the brachium is made up of a single bone, a long tubular bone called the upper arm bone or humerus. The forearm consists of two bones, the ulna, which is positioned more medially, that is, closer to the midline, and the radius, which is positioned more laterally. In Hungarian, the radius is called the orsoxont, and the ulna is called the synxont. The manus, that is the hand, is made up of many bones, and the terminology and detailed anatomical description of these will be discussed later. First of all, as a broader classification, it helps us to know that we can distinguish three types of bones here. The most proximally located are the bones of the wrist, bones, which we call the ossa carpi, the bones in the middle of the hand, the ossa metacarpi, and the phalanges, that is, the finger bones. The first bone of the upper limb girdle that we will examine is the clavicle. The clavicle is also a central bone in the sense that it is the only bone that actually attaches the free upper limb to the trunk, specifically by connecting to the sternum, thereby creating a link with it, a joint. First of all, what we need to examine in the case of the clavicle, that is the collarbone, are its surfaces and its individual parts. Overall, we can say that the clavicle can be divided into three main parts from this perspective. There is a part that serves for articulation with the breastbone, and there is a part that serves for articulation with the scapula. The surface that serves for articulation with the breastbone, that is the sternum, is called the articular surface of the extremitas sternalis, which we will refer to as facies articularis sternalis, since it is clear that this is the part closest to the sternum, that is the breastbone. The name of the other end, the other part, requires a bit of explanation because the scapula has a part to foreshadow a bit that is called a process, the acromion. This is the acromion, and the surface that serves for articulation with the acromion, as you can see, is named accordingly. So this is the extremitas acromialis, and on its most lateral part there is an articular surface, which we call the facies articularis acromialis, which serves for articulation with the acromion. In addition to all this, we can also distinguish a third major part on it, the corpus clavicular, which is essentially the body of the clavicle. If we look at the clavicle, at first glance, you can tell that this is a flat bone, a flattened bone, which, if you really want to interpret it from above, would be S-shaped, and you can see that on its upper surface there are not really any structures, whereas on the lower surface there are numerous structures, which are caused either by ligaments or by the origin of a muscle. I will describe these from the medial direction moving laterally, and the first one is for a ligament. Well, ligaments don't usually attach either, but it's simpler to say that it serves as an attachment or origin for a ligament, namely, this is where the so-called costoclavicular ligament starts. It's called the costoclavicular ligament because the Latin name for the rib is costa, and it connects the clavicle to the costal cartilage of the first rib, thereby stabilizing the position of the clavicle. Accordingly, there is an impression here, a roughly finger-sized indentation on this area of the clavicle, which we call the impression for the costoclavicular ligament. Impression for the costoclavicular ligament, so this is found on the medial part of the clavicle, specifically on its inferior surface. The next structure is caused by a muscle, namely the subclavius muscle, which, as you can see, also attaches the clavicle itself to the first rib, and the corresponding area can also be found on the inferior surface of the clavicle, which is called what we call the sulcus for the subclavius muscle, or sulcus musculi subclavii. So this groove serves as the origin for the subclavius muscle, the sulcus musculi subclavi. If we move laterally, we can find a more posterior, medially located bump, and a more lateral, anteriorly positioned groove. The more lateral or more medial posterior bump is called the conoid tubercle, or tuberculum conoideum, and the more laterally positioned groove or line is called the trapezoid line, or linea trapezoidea. These are characteristic and important because from both the conoid tubercle and the trapezoid line, there are ligaments that extend to the coracoid process of the scapula, that is, to the coracoid projection. This is also reflected in their names. From the conoid tubercle extends the conoid ligament, or ligamentum conoideum, and from the trapezoid line extends the trapezoid ligament, or ligamentum trapezoideum.
The other bone of the upper limb suspensory apparatus is the more laterally positioned scapula or shoulder blade, whose position is worth examining with the help of the ribs. As you can see, this is the bone located on the posterior surface of the trunk, roughly between the 2nd and 7th ribs, and from the medial sagittal line, or from the spinous processes of the vertebrae, which is found in this area. The scapula is located about 3 finger widths away from it. It's worth reviewing what surfaces it has. As you can see, there is an anterior surface which faces the ribs, and for this reason the anterior surface is often called the costal surface, or facies costalis, since the ribs are called costa in Latin. Therefore the anterior surface is commonly referred to as the facies costalis or facies anterior. The posterior surface, on the other hand, is called the facies. It is commonly referred to as the dorsal surface, or facies posterior. Before anything else, we should look at the major structures of the scapula. At first glance, it is clear that the scapula is a triangular-shaped bone, and as a result, it has 3 borders and 3 angles, or corners. There is a superior border, called the margo superior, a medial border, called the margo medialis, and a lateral border, which ascends steeply, and is the thickest border. This is, of course, the margo lateralis. There are 3 angles, a superior angle, called the angulus superior, an inferior angle, the angulus inferior, and a lateral angle, which is not marked by the program we are using, but I think we won't be far off if we define the lateral angle as the column scapulae. Of the scapula, when considering its individual structures, it's worth starting from the margo superior. On this border, there is a feature called the incisura scapulae superior, which is essentially a notch on the superior border of the scapula. This is significant because a nerve from the brachial plexus passes through here, specifically a nerve called the nervus suprascapularis. The nervus suprascapularis runs through this area, and later on, a ligament will also close this off, but that will be demonstrated later. If we continue to look at its structures, next to the incisura scapulae superior, there is a distinctive feature of the scapula called the coracoid process, or in Latin, the processus coracoideus. Just below the processus coracoideus is essentially the neck of the scapula itself, which we already looked at earlier. This is the column scapulae. Lateral to the column scapulae, according to some books, is a pear-shaped articular surface. Everyone can call it what they like. This is the cavitas glenoidalis. The cavitas glenoidalis is significant because, as you can see, this is where the head of the humerus, that is the upper arm bone, fits in, and thus it forms the shoulder joint, which we will later refer to as the articulatio humeri. And then, both above and below the cavitas glenoidalis, there are various bony structures that serve as origins for muscles. Since one of them is located above the cavitas glenoidalis, we call it the tuberculum supraglenoidal, and there is another one below the cavitas glenoidalis, which we call the tuberculum infraglenoidal. The tuberculum infraglenoidal, the long head of the triceps brachiae muscle, originates from the infraglenoid tubercle, while the long head of the biceps brachiae muscle originates from the supraglenoid tubercle. But we will discuss this in more detail later. That's all about the structures found in this area. A characteristic feature of the posterior surface of the scapula is the spine, which we call the spina scapulae. The spina scapulae is clearly visible. The posterior surface of the scapula is divided into 2 larger parts. There is a groove above and another groove below the spine of the scapula. The groove above the spine of the scapula is called the supraspinous fossa, while the groove below the spine is called the infraspinous fossa. Muscles originate from both the supraspinous and infraspinous fossae. From the supraspinous fossa, the muscle of the same name, the supraspinatus muscle, originates, while from the infraspinous fossa, the muscle of the same name, the infraspinatus muscle, also originates. If we follow the path of the spine of the scapula, after it separates and moves away from the body of the scapula itself, it is called something else. This is the acromion, which was already mentioned with the clavicle. This is the acromial process, the shoulder tip process of the scapula itself, and this is significant because, as you saw earlier, this forms a crucial joint with the clavicle, thereby creating what is specifically called the acromioclavicular joint. Okay, and that's essentially all about the dorsal surface. One more important thing you can clearly observe here is the precise point where the prominent spine of the scapula distinctly separates from the main body of the scapula. This particular area is quite often referred to as the incisura spinoglenoidalis, or in some places it's also called the incisura scapulae inferior, because above this area you can find the incisura scapulae superior. And so in some sources, this is referred to as the incisura scapulae inferior, meaning the lower notch corresponding to this on the scapula. On the anterior surface, there isn't much to see. This area is in general, we call this the fossa subscapularis, because this is where the subscapularis muscle originates. And since a muscle originates here, it exerts a certain pulling force, and this pulling force creates bony ridges on the anterior surface of the scapula. These are not marked by the program, but you can see these bony ridges here, which are called lineae musculares. The very first bone of the free upper limb, and indeed the one located most proximally within this anatomical region, is the humerus, which is commonly known as the upper arm bone. This significant bone, the humerus, much like most other long bones found in the human body, is generally and systematically divided into three primary and distinct parts. Specifically, a robust proximal epiphysis, a corresponding distal epiphysis, and the elongated diaphysis, which is strategically located between these two ends. The proximal epiphysis and the distal epiphysis, both crucial components. The epiphyses are very rich in anatomical structures, whereas the diaphysis is less so, but it also contains some features. The most proximal part of the proximal epiphysis is the caput humeri, which faces medially. This caput humeri fits into the structure already mentioned on the scapula, specifically into the glenoid cavity, and together they form the shoulder joint, the articulatio humeri. Below the caput humeri and distal to it, there are two structures called tubercles. One of them, located more laterally, is the tuberculum majus, which is the larger tubercle, and on the anterior surface of the proximal epiphysis of the bone, there is a smaller tubercle, the tuberculum minus. So, there is a laterally positioned tuberculum majus, and a medially, well, not medially, but rather the prominent tuberculum minus, which is strategically located on the anterior surface of the humerus bone. Between these significant tubercles and the caput, or head, lies the crucial anatomical neck of the humerus, a distinct region, because it also possesses a separate surgical neck. This specific anatomical neck is formally designated as the column anatomicum. Furthermore, between the larger tuberculum majus and the smaller tuberculum minus, there exists another exceptionally important bony structure called the intertubercular sulcus, also known as the bicipital groove, which serves as a passageway for the long head of the biceps brachii tendon, sulcus intertubercularis. Important structures also pass through the sulcus intertubercularis, as we will see later. So the sulcus intertubercularis is located between the tuberculum majus and the tuberculum minus. Distal to the tubercles, roughly at the border between the diaphyses and the proximal epiphyses, is the structure called the surgical neck, or column chirurgicum. This surgical neck, and the reason it got its name, is that when someone falls on their upper limb, if the humerus breaks, it most often fractures in this area, since this is, in this sense, the weakest point of the bone, and this is where it tends to break. What we can also observe in this area are the continuations of the tubercles. Both the tuberculum majus and the tuberculum minus have distal extensions in the form of bony ridges. The bony ridges are generally called crests. There is a so-called crista tubercula majoris, which is the continuation of the tuberculum majus, and there is a crista tubercula minoris, which is the continuation of the tuberculum minus. These are roughly the structures you can find on the proximal epiphysis. If we look at the diaphysis, there is a structure here that serves as the attachment for a muscle, and this is the more laterally, and in theory, more proximally, the deltoid tuberosity should be located. This serves as the attachment for the deltoid muscle, and if we display the deltoid muscle, which is called the musculus deltoideus. You can see roughly where this structure should be situated on the humerus. As you can see, the deltoid muscle attaches in this area, and if I, instead of hiding it, just move it aside, you can then see that this is the area where the deltoid tuberosity, which serves as the attachment for the deltoid muscle, should be located. As you can also see, this structure is found on the posterior surface and shaft of the humerus, which the program does not indicate very well. For this, it is useful to display another structure, which is also a nerve, the radial nerve, because a structure corresponding to the radial nerve is found on the humerus, on the posterior surface of its shaft, and this is called the sulcus nervi radialis. This is exactly where it is located, where the radial nerve passes along the posterior surface of the humerus. This is the sulcus nervi radialis. You can see that this is a mediolateral structure, meaning it spirals from the medial direction toward the lateral direction on the humerus. Additionally, on certain specimens, you can also see a structure which we call the foramen nutritium. This can be translated as the nutrient foramen or something similar. The point is that this is the area where the blood vessels enter that actually nourish the bone, so we call it the foramen nutritium. There are no other structures on the diaphysis, but on the distal epiphysis we can observe several structures. On one hand, the most characteristic structure of the distal epiphysis, which we collectively call condylus humeri. Here you can see the condylus humeri, and the condylus humeri can be divided into two smaller parts. One is the more laterally positioned capitulum humeri, which is the small head of the humerus, and the other is the more medially positioned trochlea humeri, which is a roughly horizontally oriented hourglass-shaped structure of the condyle. There are also structures located above the condyles, and in Latin, when something is situated above something else, we usually use the prefix epi, which is why these are called epicondyles. There is a smaller, more laterally positioned epicondyle called the epicondylus lateralis, and a larger, more medially positioned one called the epicondylus medialis. So there is a more lateral epicondylus lateralis, marked here in red and purple, and the larger, more medial epicondylus medialis. Beneath the epicondylus medialis, there is also a structure that is also serves as a crucial passageway for a significant nerve, specifically the anatomical groove known as the sulcus nervi ulnaris. And from this, you can deduce with certainty which crucial nerve passes through this specific anatomical pathway. It's also a significant branch of the larger brachial plexus, namely the ulnar nerve, a vital component of the peripheral nervous system. And you can see that it passes through that distinct anatomical area, clearly highlighted here in a vibrant green color, within the precise anatomical region of the sulcus nervi ulnaris, which is the distinct area strategically located directly beneath the prominent bony landmark known as the epicondylus medialis. Okay, and what else we can see here is that the epicondyles also have continuations, just as we saw with the tubercles at the proximal epiphysis. Here we also define these as bony ridges, and we call them crests. The continuation or extension upward of the lateral epicondyle is called the crista supraepicondylaris lateralis, while the continuation or extension upward of the medial epicondyle is, in the proximal direction, that is the crista supraepicondylaris medialis. What else we can see on the distal epiphysis are grooves and fossae. Above the capitulum humeri, so this was the capitulum humeri, and here is the trochlea humeri. Above the capitulum humeri we find a groove, this is the fossa radialis, and above the trochlea humeri we can also find a groove, and this is the fossa coronoidea. So above the capitulum humeri is the fossa radialis, and above the trochlea humeri is the fossa coronoidea. There is another fossa as well, but that is located on the posterior surface of the distal epiphysis, and this is called the fossa olecrani. This structure is called the fossa olecrani because it accommodates a structure found on another bone, the ulna. As we will see, the ulna has a feature called the olecranon, and the olecranon of the ulna fits into the fossa olecrani located on the posterior surface of the distal epiphysis of the humerus. The bones of the forearm. In the forearm, there are two bones, one positioned more medially, the ulna, and one positioned more laterally, the radius. It's easy to remember their positions by noting that the radius is essentially the one that points toward the thumb, while the ulna points toward the little finger. This makes it simple to distinguish them. Looking at these forearm bones in more detail, it's best to start with the ulna. The ulna, as a long tubular bone, can be divided into a proximal epiphysis, a distal epiphysis, and the shaft corpus located between the two. The proximal epiphysis actually looks like a wrench. It has a forward-facing notch called the trochlear notch, a incisura trochlearis, and it features two processes. One of these processes is called the olecranon, which is located at the back, and there is another process called the coronoid process of the ulna, Procyon coronoideus ulnae, which is located at the front. The trochlear notch, incisura trochlearis, is significant because the trochlea of the humerus fits into it, so the trochlea humeri articulates with this, and together they partly form the elbow joint. On the lateral side of the trochlear notch, in this area, there is another notch called the radial notch, incisura radialis, and you can also see here that this will serve for the articulation with the head of the radius. If we look at other areas of the proximal epiphysis that may be important, there is a bony ridge located laterally and close to the radial notch called the supinator crest, crista musculi supinatoris. This serves as the origin site for the supinator muscle, which is a muscle of the forearm. Another area, also related to a muscle, is not for origin but for insertion, namely this specific anatomical area is precisely located on the anterior or front surface of the ulna, and it is formally designated as the tuberositas ulnae. This particular site serves as the crucial insertion point for a significant muscle, which originates from the humerus and is scientifically known as the brachialis muscle. Moving on, the diaphysis itself is not inherently complex or particularly noteworthy, with the notable exception of possessing a very distinct and easily recognizable ridge. This ridge is remarkably sharp and prominent, even when observed on meticulously prepared anatomical specimens. This prominent feature is in fact the interosseous border. We call it that. And it's important because the ulna, and more precisely the radius, also has a similar ridge, which we call the interosseous border. Between the interosseous borders of the two forearm bones stretches a membrane called the interosseous membrane of the forearm, membrana interossea antebrachii, and this is located between the corresponding borders of the two forearm bones. The distal epiphysis is not particularly interesting. It's interesting that here is where the head of the ulna, the so-called caput ulnae, is located. On the medial side of the caput ulnae, there is a projection called the styloid process of the ulna, processus styloideus ulna. By the way, returning to the coronoid process of the ulna, it's important to add that when we refer to the coronoid process of the ulna, processus coronoideus ulna, we are specifically indicating it. That we are talking about the ulna because another bone, the mandible, also has a similarly named projection, namely the processus coronoideus mandibula. So it's important to specify which bone we're referring to, since if one of them breaks, for example, it's worth indicating in a medical report which bone's coronoid process has fractured. Of the two forearm bones, the one located more laterally is the radius. Similar to the previous bones, the radius can also be divided into the proximal epiphysis, the distal epiphysis, and the diaphysis or corpus located between the two. The proximal epiphysis is where we find the head of the radius, known as the caput radii. So, the caput, the head of the radius, and on its head there is an articular surface, which is called the fovea articularis, or more precisely, the fovea capitis radii. If we look at the fovea capitis radii, we can see that it serves for articulation with the capitulum of the humerus, and thus it also contributes to the formation of the elbow joint. There is another articular surface in this area, on the region of the head of the radius, but unlike the previous one, this one is located around the circumference. This is called the circumferentia articularis. The circumferentia articularis will articulate with two things. On one hand, with the incisura radialis of the ulna, and on the other hand, with a ligament, which we will see later. Distal to the circumferentia articularis is the narrowing neck of the radius, which is the column radii, and on its anterior surface, similar to the ulna, we can also find a tuberosity, which is called the tuberositas radii. As you remember, there was a similar one on the anterior surface of the ulna as well, which was the tuberositas ulnae, but this is the tuberositas radii, and a muscle also attaches here. Specifically, the tendon of the musculus biceps brachii attaches in this area. The corpus, like before, is not particularly interesting, but it does have the margo interosseus, this sharp edge, where the membrana interossea stretches between them. The distal epiphysis is more massive, just like the proximal one, and this is how you can orient the radius when you are handed it, by which end you hold. On this, there is an articular surface on the lower surface, which serves for articulation with the carpal bones. Marked in pink, this is the facies articularis carpalis, facies articularis carpalis radii, so this serves for articulation with the carpal bones. And there is another articular surface as well, which is also covered by hyaline cartilage, and that is the incisura ulnaris radii, that is to say the distinct incisura ulnaris radii, which specifically serves for articulation with the ulna. So, There are indeed two primary articular surfaces in this particular area of the radius. There is an incisura, or more precisely, the significant fascies articularis carpalis, which serves for articulation with the various carpal bones, and there is also an incisura radialis, a prominent incisura radialis, and finally an incisura ulnaris, which serves for articulation with the adjacent ulna, forming a crucial joint. On the posterior surface of the distal epiphysis, there are distinct grooves, specifically called sulci tendinae, which are quite prominent. These particular sulci tendinae serve a vital function for the smooth passage of the various tendons of the powerful forearm muscles, or more precisely, their presence and formation are directly caused by the constant movement and friction of these very important tendons. The posterior surface, this often observed anatomical feature, the more prominent part of the radius, is also sometimes referred to in some places as the tuberculum dorsale. Another thing worth mentioning here, which is similar to what we saw on the ulna, though there it was located medially, while here it is located laterally, is the processus styloideus radii. Above the processus styloideus radii, there is a ridge called the crista suprastyloidea, because it is located above the prominent anatomical processus styloideus, and specifically known as the distinct bony crista suprastyloidea. From the upper limb, that is, the hand would be the manus. We divided the manus into a proximally located area made up of the carpal bones, which we call the ossa carpi. Distal to these are the ossa metacarpi, and most distally are the phalanges, that is, the finger bones. First, it's worth examining the ossa carpi, the bones that make them up. In the case of the ossa carpi, that is the carpal bones, we can say that there is a proximal row of bones and a distal row of bones. The proximal row is called, in Latin, nicely, ossea carpalia proximalia, while the distal row is called ossea carpalia distalia, and the bones that make up these rows are usually listed in a radial nerve, that is, from lateral to medial direction, as is customary. The most radial, that is, the most laterally positioned bone of the proximal row, is the os scaphoideum, that is, the scaphoid bone. Next comes the os lunatum, which is the lunate bone, followed by the os triquetrum, or the triquetral bone. After that comes the os pisiform, the pisiform bone. The most lateral bone of the distal row is the os trapezium, the trapezium bone. Then comes the os trapezoideum, the trapezoid bone, followed by the os capitatum, the capitate bone, and then comes the os hamatum, which is the hamate bone. The easiest way to remember these is by using mnemonic words. For the proximal row of bones, the term scalotripi can help, as it allows us to recall both the constituent bones and the order in which they are arranged. For the distal row, the mnemonic tratrakaha can be useful. What is important to note above all about these bones, due to the threefold, if we look at where each is located, we see that they are not necessarily positioned right next to each other. For example, there is a bone called the os pisiform, which is notably situated on the upper surface of the os triquetrum in anatomical position, and together they form a groove through which various structures pass and enter the area of the hand. This area is called, in the case of the bony hand, meaning before we add ligaments and other structures, the sulcus carpi. The sulcus carpi has a side that is positioned radially or laterally, and another side that is positioned medially or ulnarly. The medial side of this groove is called the eminentia carpi radialis or eminentia carpi lateralis, while the side that is positioned medially or ulnarly, the side of this groove is called the eminentia carpi ulnaris or eminentia carpi medialis, and it's also important to know which structures form these eminences. Of course, the diagram is very schematic. It shouldn't be imagined exactly like this in reality, but it can be helpful. Both the eminentia carpi radialis and ulnaris are formed by different bony structures, medially, and more precisely, both proximally and distally. The eminentia carpi radialis, proximally, is formed by the tubercle of the scaphoid bone, which we call the tuberculum ossis scaphoidei, while distally it is formed by the tubercle of the trapezium bone, the os trapezium, which we call the tuberculum ossis trapezii. The eminentia carpi ulnaris is also formed by two bony structures. One is a single bone. Proximally, the os pisiform forms it, which is located on the upper surface of the os triquetrum. And distally, a characteristic structure of the hamate bone, also known as the os hamatum, forms it, which we call the hamulus ossis hamati. The last major region of the free upper limb is the hand, or manus, which we can divide into the carpal bones, ossa carpae, the metacarpal bones, ossa metacarpi, and the fingers and phalanges, commonly called phalanges or phalanxes. The carpal bones have a proximal and a distal row. The most radially positioned bone of the proximal row is the scaphoid bone, os scaphoideum, followed by the lunate bone, os lunatum. Then comes the triquetrum, os triquetrum, and on the triquetrum is the pisiform bone, os pisiforme. The distal row also consists of 4 bones. The most radially located is the trapezium, os trapezium, followed by the trapezoid bone, os trapezoideum, and after the trapezoideum, the capitate, and finally the hamate, os hamatum, which has a special feature, the hook of the hamate, hamulus, ossis hamati. These structures form the eminences. These characteristic features make up the medial and lateral carpal eminences, and between the two lies the carpal sulcus, through which various structures pass, such as tendons of muscles, or for example, a nerve. This nerve is called the median nerve, but we only refer to it as the carpal sulcus if it is not covered by any ligaments or other structures. In this case, we simply call it the carpal sulcus. If the ligaments also cover it, then we refer to it as the carpal canal, so in that case, it is considered a canal. Good, there are a total of 5 metacarpal bones, which we call the metacarpals. At first glance, it is clear that these are classic long bones, which have the following features. The previous, just like before, have a proximal epiphysis, a distal epiphysis, and a diaphysis located between the two. In the case of the metacarpal bones, we use special terms for these parts. The proximal epiphysis is always called the base, the distal epiphysis is called the head, and the diaphysis between the two is called the shaft. Both the proximal and distal epiphyses also have distinct articular surfaces, which we precisely call articular facets, facies articularis, and these specifically serve for articulation with the corresponding bone structures. They also play a very significant and crucial role in the intricate formation of various joints throughout the body. The individual fingers can be systematically numbered, with the prominent thumb always being consistently assigned the number 1, the digit closest to the wrist, followed by the other digits in sequential order. The index finger is designated as number 2, while the middle finger is assigned the numerical value of 3. Following this, the ring finger is identified as number 4, and the smallest digit, the little finger, is specifically assigned the number 5. These distinct digits of the hand also possess their own traditional Latin names. For instance, the very first digit, which is commonly known as the thumb, is formally called the pollex. Moving on, the index finger, often used for pointing, is known by its Latin designation, the index. Subsequently, the middle finger, positioned centrally among the digits, is referred to as the digitus. The ring finger is precisely known as the digitus annularis, while the little finger is accurately termed the digitus minimus. Each of these individual fingers is fundamentally made up of 3 distinct smaller tubular bones, with the notable exception of the thumb, which has a different structure. The general anatomical structure of the fingers is consistently organized as follows. There is a proximal phalanx, which is the bone closest to the palm, an intermediate phalanx, situated between the proximal and distal phalanges, and finally a distal phalanx, which is the outermost bone of the finger, a distal phalanx, and between the two is the middle phalanx, so there is a proximal phalanx, a middle phalanx, and a distal phalanx. The exception to this is the thumb, as it only has a proximal and a distal phalanx. It does not have a middle phalanx. It's important to note that it's called the middle phalanx, not the medial phalanx. Their general structure is similar to that of the metacarpal bones of the hand, meaning they have a proximal and a distal epiphysis, with a diaphysis located between the two. These anatomical structures are also specifically named as the basis, the caput, and the corpus. However, a notable exception to this general rule applies to all 5 distal phalanges, as they do not possess a caput, but instead terminate in a very special and distinct structure, which is precisely called the tuberositas phalangis distalis. This tuberositas phalangis distalis is actually the primary attachment point for various tendons and ligaments, playing a crucial role in the overall function and stability of the digit. A robust structure that primarily serves to firmly support the delicate nail bed and the sensitive tips of the human fingers.